Okay, here we go. So we start to talk about what Dr. Landis calls the chapter on the bad bugs. And we're going to talk about bad bugs in the entire time left in this semester. And it's pretty good because we have a chance to talk about bacteria first. Then I'm gonna introduce you to the viruses. We're gonna chat a little bit about them. And then hopefully we will have time to talk about fungi and protozoa. Okay. So bacteria can be divided into two groups, as you remember, gram-positive and gram-negative. There are some other versions, and I'm going to build the story. I sometimes call it a microbial parade, and I kind of hate how we have to talk about one microbe after another. It looks like we walk through the zoo and I show you the animals, okay? But that's the way we have to discuss the clinical microbes. So we're going to start with the genus that first comes to mind when we talk about gram-positive bacteria. It's a genus of Staphylococci. Bless you. There are many species, but I'm going to mention two. One that is definitely pathogenic. It's a Staphylococcus aureus. We have that discussion that Staph aureus can be often found as the component of the normal human microbiome of the respiratory tract. Okay. However, it can cause quite severe infections, limited mostly to the skin and upper respiratory tract. There's a variety of virulence factors that it possesses. I want you to know three of them based by type. One is exoenzymes that attack extracellular matrix, such as hyaluronidase. Okay. Second is superantigen toxic shock syndrome toxin, TSST. Okay. And the third is exfoliative toxin. And we're going to talk about how these enzymes are linked to the clinical picture of the Staphylococcus aureus infection. In terms of the skin infections, Staph aureus causes a variety of diseases, starting from impetigo, and if you have kids that play contact sport of any kind, you probably had to deal with that disease. We had one kid in the football team in the third or fourth grade that got it, and then gradually the entire team acquired it. It's the Staph aureus infection of the skin that causes this peeling lesions. They're not scratchy, they're not painful, but the main problem with any skin infection is what? If skin starts to get destroyed. What is the problem that can follow? Huh? Exactly, secondary infections of subcutaneous tissue. So that goes the same for impetigo. That's the name of the disease. Okay, now if microbe gets under the skin, it can cause the disease called erysipelas and cellulitis. It's not here. I'm not gonna, since it's not on a PowerPoint slide, you don't have to know erysipelas and impetigo. Sorry, erysipelas and cellulitis. Okay, it's inflammation of the tissues under the skin, the subcutaneous tissues. It is usually characterized by redness and what is sometimes called lymphangitis. When lymphatic vessels become inflamed, and you can see them under the skin, the red inflamed lymphatic vessels. When Staph aureus infects the hair follicle, bless you, it forms furuncles. The purulent bumps on the skin, when several furuncles fuse together, they form much larger lesion that is known as carbuncle. Usually carbuncles and furuncles, in some cases the antibiotic treatment is sufficient, but in case of carbuncles often the surgical drainage is necessary. As a kid I experienced that. The physician tricked me saying that he just wants to look. I didn't see him grabbing the whatever instrument it was, okay, and he pretty much stuck it was on my elbow, he stuck it in, opened it up. No anesthesia, of course. So he drained it, he treated, but it was awfully painful. Now we're kind of going from the less, I wouldn't say malignant, but not so bad to bad. And the next condition that I want to talk about, and that is associated with the Staph aureus infection, is scalded skin syndrome. So this micrograph exemplifies what's going on. There's a separation between epidermis and dermis, between the superficial layer of the skin and deeper layer of the skin, because of the exoenzymes produced by Staph aureus. They destroy the basement membrane, causing slowing off of epidermis, and that infection is pretty common in the newborn kids. Again, by itself, it doesn't lead to any serious complication. By itself, it's not that dangerous, but it exposes a newborn to increased risk of secondary cutaneous infections. It can be successfully treated with antibiotics as practically any other infection with Staph aureus. However, if the bacteria migrates deeper into the tissues, it can cause the condition known as necrotizing fasciitis or flesh-eating bacterial infection. In this case, Staph aureus destroys connective tissue that holds together muscles and ligaments, and the major treatment in this case is surgical debridement of the wound. In case of necrotizing lesions like that, another treatment that is actually approved by FDA is the treatment with fly larvae, that we know as maggots. Fly larvae primarily destroy dead tissue. So special sterile larvae are applied into the wound, and they will eat out the dead tissue, leaving healthy parts of the wound intact. Does that make sense? They have to be monitored though, because once they run out of the dead tissue, they will munch on the live as well. Okay, but it's an official treatment. Now so this infection can get into the systemic circulation. So if it's just the bacteremia, microbe can still reach the far parts of the body, so it can become, from focal, it can become localized infection. Staph aureus is the very common cause of endocarditis, infection of the cardiac valves. It forms vegetation, so-called vegetations, grape-like growth on the valves, and it impairs the blood flow through the valves. And this type of infection is very hard to treat because drugs, and those are usually different types of beta-lactams, starting from penicillin, cephalosporins, carbapenems. these types of infection are quite hard to treat because in case of endocarditis, for instance, antibiotic has to be administered, usually IV, to maintain levels of antibiotics in the blood sufficient enough to treat the disease. Another very common site for staphylococcal infection is bones. It's called osteomyelitis. Especially if the bone was damaged, like the bone was broken, okay? Even if it's a small stress fracture or hair-like fracture, if there is any bacteremia, Staph aureus, then it can cause the infection of the fractured bone. Of course, if it replicates in the blood, that causes sepsis. That's a totally different story. Some strains of Staphylococcus, as we discussed, produce the toxic shock syndrome toxin, TSST, which causes hyperactivation of the immune system and leading to the toxic shock syndrome. Does that make sense? Now, Staphylococcus saprophyticus is a pathogen that is it's associated virtually only with the urinary tract infections. Okay, as well as Staph aureus, but Staph saprophyticus is a pretty common cause of urinary tract infections that can, as you know, progress to. So if it starts in the urethra, it can then progress to cystitis, infection of the bladder, and if untreated, microbe can reach through the ureters into the kidney, and kidney infection will cause pyelonephritis or pyelitis. Does that make sense? Now, the second group that comes to mind when we talk about gram-positives is streptococci. Strep pyogenes. And I want to highlight, so Staphylococcus, before we move, Staphylococcus is the microbe common in the respiratory tract and on your skin. Streptococcus is the microbe that some of the species of Streptococci represent normal microbiome of your mouth, like Streptococcus mitis or Streptococcus mutans. Now, Strep pyogenes is not normal. It's the pathogen that causes strep throat. Okay, pharyngitis. You can see the picture, the photograph of a throat, the pharyngitis here. You can see this white inflammatory patches on the tonsils, which correspond to the sites of infection with Streptococcus pyogenes. Now, Strep pyogenes, don't get me wrong, it can also cause skin infections. So, like Staph aureus, it can cause impetigo and it can cause erysipelas. That's an example of erysipelas right here. Okay, in the right bottom corner. It's a person with subcutaneous infection by Strep pyogenes. But most common disease associated with streptococcal infection is strep throat. If you would talk to people who grew up, like your grandmothers, okay, that grew up in the first half of the 20th century, when they hear strep throat, they get pale and they stay scared. They're really scared. Some estimates suggest that in the 19th century, the mortality rate among kids who acquired strep throat, strep pyogenes infection, could reach 80%. Think about this. 4 to 5 kids with strep throat died. Of course, they didn't die because of the strep throat per se. Strep pyogenes, since there was no specific treatment, strep pyogenes could migrate from throat into the systemic circulation, causing much more profound systemic disease known as scarlet fever. Pretty much it's a systemic, it's a bacteremia, strep pyogenes bacteremia. It involves non-specific immune activation, which means very high fever. That's pretty much it, actually. But the mortality rate from scarlet fever without treatment was pretty high. One of the characteristic symptoms, well, it should be signs, of scarlet fever is the rash, localized to the cheeks and upper part of the trunk. One of the very common complications of scarlet fever was deafness among kids. Now, this microbe also can cause toxic shock syndrome, and if scarlet fever remains untreated, the rheumatic fever can ensue. Rheumatic fever, so rheumatic, usually refers to what part of the body? Joints, yes. In rheumatic fever, microbe localizes itself to joints, causing arthritic symptoms, and at the same time, it also invades heart, causing endocarditis, infection of the valves. That makes sense? As most gram-positives, it can be effectively treated with beta-lactams, and the transmission of strep pyogenes is either respiratory or by contact. So staph and strep, as you can see, are pretty similar in the location and in the transmission. That makes sense. Now, another streptococci that has a huge clinical importance is Streptococcus pneumoniae. This is the causative agent of two major conditions: pneumonia and pneumococcal meningitis. Another name for that microbe is pneumococcal. Now, for any microbe that we have vaccine against, I put a little asterisk next to it just to give you an idea so you can look at it and just see it. Now, strep pneumonia causes so-called community-acquired meningitis, okay, inflammation of the meninges, the tissue layers surrounding the brain. It usually manifests as the high fever, headache, and the characteristic sign, well, it's going to be symptom, sorry, I'm mixing it up. Symptom of meningitis is a stiff neck. Okay, can be treated pretty successfully with a number of drugs. You don't have to know the treatments. I'm not going to ask you what you're going to treat sorry, strep pyogenes with. Beta-lactams, tetracycline, or, I don't know, fluoroquinolones. That makes sense. You're not going to get that question. Okay, but I will ask you, do we have a vaccine against this microbe? Or which microbe we can vaccinate against? Please note. In terms of the virulence factors, the virulence factor that I want you to know for strep pneumonia is the capsule. And for strep pyogenes, I want you to specifically focus on superantigen that it can produce and streptolysin. So streptolysin is the exoenzyme that contributes to the hemolysis. It destroys the red blood cells. Okay. Streptococcus Agalactiae is another example of hemolytic streptococcus, which is encapsulated. So know that capsule is the virulence factor for Streptococcus Agalactiae. Why I focus on this guy? It's a pretty common inhabitant of the female birth canal, okay? Part of the vaginal vaginal flora. And if Streptococcus Agalactiae is acquired by the neonate during the birth, it can cause the disease known as neonatal meningitis. In fact, Streptococcus Agalactiae is one of the leading causes of neonatal meningitis. Does that make sense? Along with two other microbes, E. coli and Listeria monocytogenes. Okay? So, specifically for the exam, I will ask you mostly questions like, which of these diseases is caused by? Mostly by Strep Agalactiae. And you will have to pick neonatal meningitis. Does that make sense? Okay, so that's focus on the diseases. I will tell you exactly which virulence factors you should know. Transmission, and in this case it's going to be transmission from mother to child, okay, during the birth, and whether or not we have a vaccine. If there is something I want you to know that is out of this, that is out of the disease, virulence factor, vaccine, and transmission, I will absolutely mention that. Okay? These guys I like a lot. These are bacilli. Again, it's all gram-positive. Okay? It's all gram-positive bacteria. As you can imagine, bacilli have a shape of bacilli. You can see the Streptobacilli, Bacillus Aureus on this electron micrograph. And you can see Bacillus Aureus cultured in the blood agar. These microbes are usually soil-dwelling, or they are in the environment. And the feature of practically, well, not practically, all bacilli, they form endospore. So bacilli are really hard to kill. You cannot destroy them by, for example, boiling or desiccation. And they survive in the environment very well. So Bacillus Aureus possesses, can we consider endospore a virulence factor? Yes, we can, because it increases the chances for infection. Now, Bacillus Aureus has two major virulence factors, capsule, okay, both of the bacilli species have capsule, and it produces thermostable exotoxin. Now, we discussed that. I just want to remind you the disease that is mostly associated with the Bacillus Aureus bacteria. It's a food poisoning. And I want to highlight, it's not an infection of the digestive tract, it's the poisoning. So remember we talked about rice cooking, and how it is left at about 50-60 degrees Celsius in the restaurant. That moist, hot environment promotes germination of Bacillus endospores. Does that make sense? Microbe replicates, produces toxin, and it's thermostable toxin, so it remains on rice. When people consume rice, they consume toxin. Toxin causes food poisoning. If you will treat the patient with such food poisoning with antibiotics, is it going to help? No, why?
You're not treating, in this case, for bacteria, you're treating for toxins.
Exactly. It's not replication of microbe in the digestive tract, it's intoxication. The treatment is supportive. Okay? Just survive through the diarrhea and vomiting. Okay? Another bacillus that I really want to mention is Bacillus Anthracis. The causative agent is the causative agent of anthrax. In Russian, we actually have a different name for it. If you literally translate the Russian name for that disease, it means Siberian ulcer. It causes these ulcers that are called eschar if it is a cutaneous form. Okay, how it is usually we can pretty much exclude the fly-mediated transmission and focus specifically on the transmission from cattle to humans. So it's a common disease of cattle. Large ruminant animals. If there are no cattle, then it's going to be something else. Okay, so it's pathogenic in, for instance, cows, and humans can acquire it while handling the corpses of infected animals by consuming the meat of infected animals or by touching infected animals. So there are three major forms of anthrax. One is cutaneous, okay, that's eschar, but you can see you shouldn't take it lightly. You see, it can go pretty bad. It can cause respiratory, okay, inhalation, and it can cause digestive, ingestion. Do you follow me so far? So which one do you think is the worst? Respiratory. Digestive is not really optimistic either, but people usually acquire respiratory form first, and often at the time when they can consume the meat, it's the last thing they want to do. Okay, you probably remember the anthrax attacks that happened, I think it was 2001, somewhere in that ballpark, right after the 9/11. Turned out not to be an imported terrorist. It was a homegrown, desperate scientist that, at least they tracked it down to one very disgruntled guy at, I think, CDC, who had an access to anthrax spores and pretty much sent them out. So people who received those letters, they developed respiratory anthrax because they inhaled the spores. Respiratory anthrax is extremely severe, develops very rapidly, and is really hard to treat. Very, very hard to treat. Now, anthrax outbreaks. So you can see, okay, let's start with epidemiology. You can see that epidemiology here. And epidemic or endemic countries are located. That is Turkey. Countries in Africa. This I don't remember. I think it's Laos or Burma. And this I have no freaking clue. That's some old former Soviet Republic of Soviet Union, I think. Should be Tajikistan. Now, pink are endemic, like China or Argentina. Yellow is sporadic, and green is probably free. You can see that Greenland and Scandinavia is free. For some reason Egypt is free. It's mostly cattle control. Okay. I don't think there's a lot of cattle in Greenland, to be honest. So how it happens. So first of all, the microbe normally resides in soil in the form of spores. Okay, and the spores are in the soil, on the vegetation. When cows consume the spores. Spores, or inhale them. Spores germinate either in the intestine or in the lungs. What happens to the cows next, once the spores germinated? Simple question. They become what? They get what? No. What they get, how do they feel? Sick. Yeah, that's it. They get sick. Okay? They sick. Microbe replicates in them. They really sick. They can die. So you have a ton of cattle that is dead. Okay? Can you sell it? Well, that was always, for me, like a thing about English language. You technically can, but you can get imprisoned for that, because it's kind of, what? A murder, right? So you must destroy it. How? Burn it. How do you burn a cow? No, it's not. It is. It's really a question, like, for a farmer. I mean, one thing is if you have cows with, I don't know, foot and mouth disease. It's milder, a little milder. But still, how do you burn a cow? How do you burn a human? Presuming the human is dead. Cremation. So you, yeah, so something like really hot. It's usually like industrial size. You're not just throwing the corpse on the bonfire, okay? It's not going to work. Temperature's not enough. So now, one cow, I mean, you can make really big bonfire and spend like several hours watching it burning, but it's probably not going to destroy all of it. So if you have, say, 2,000 animals that you have to destroy, it becomes a little bit of a challenge to burn them all. That makes sense? So if you cannot burn them, what do you do with them? Well, if we don't burn humans, what else can we do with human corpses? We bury them. Same goes for cows. We can bury them. So it's simply, you dig the hole in the ground, you put them in, cover them with soil. What do you have to do next after you buried several hundred, or whatever the amount is, pretty large animals that are, or were at this time, infected with anthrax? It's just, there you go. You have to mark the burial place, right? You have to mark biohazard. You're absolutely right. Biohazard, do not cross. You have to put the label on the map. You got to get those records, And look, usually you don't do it like in the city limits, right? Or in the village limits. You try to do it pretty far from the place you live. So you reduce the risk for exposure. What's going to happen with those marks and labels and everything else over time? Yeah, it's all going to get mixed up. They're going to disappear, People tend to forget, make mistakes. So that happens quite frequently back home, especially in the northernmost part of Russia. One of the major agricultural industries? I don't know how to, I kind of lost for words. So people raise reindeer. They raise them for pelt, for skins, for meat, for milk. Okay, it's a major way to kind of travel around. It's a major animal. And of course, they acquire anthrax, and then they call the entire herd, and they bury them. It's very, very north. And in the north, there's a little layer in the soil. Permafrost. And you try to, you bury them and there's permafrost. It's pretty much like a frozen soil, right? A lot of ice in the soil. So two things. First, summer, and summer's the average temperature every year gets warmer. Permafrost thaws better. More water is formed in the ground, and capillary forces pull the water up. And with water, endospores move up too. And then new herds graze on that grass, acquire the anthrax, and there you go, you have new outbreak. The most recent happened in the fall of last year. 300-something cases of infection, 1 dead. It was a kid, they cooked the infected animal. They didn't know that it was infected. Kind of tragic irony. His own grandmother cooked that animal and the boy ate it, acquired endospores and died quickly because of the intestinal form of infection. Okay, so it happens. Okay, anthrax was one of the, for all of you, I don't know how, I know the Russian word for it, but I don't know English for it. Like people who believe in the total apocalypse and destruction of humanity, anthrax was considered to be a biological weapon. Most useful maybe, because endospores. Because you can grow a lot of microbes, trigger them to sporulate, collect endospores and spray them all over the enemy lines. What's the problem with that kind of biological warfare? Number one, it's indiscriminate. There you go. Yeah, so pretty much if you have an area that is clean and there's no anthrax, you introduce anthrax there, good luck getting rid of it. Does that make sense? So it's kind of, biological warfare is a lousy warfare. Another interesting bacillus, just to let you know, Bacillus Thuringiensis. Have you heard about BT insecticide? No? It's actually pretty common and widely used insecticide. It's lyophilized Bacillus Thuringiensis. There's some protein in the bacteria that kills mosquitoes. It's certified organic. And it is used, for instance, in Florida. They have a special state service that uses BT for mosquito control over the southern tip of Florida and 7 Keys. They fly the planes and just spray it. And it's not a chemical. It's biological. Does that make sense? It's pretty good. So far, there's not very much resistance against it. So what you have to know, the diseases, 3 forms of anthrax, and therefore transmission. So spores can be eaten, inhaled, or get on the skin. In terms of the virulence factors, capsules for both, thermostable toxin for Bacillus Aureus, and for Bacillus Anthracis, I do not ask you what is the mechanism. I can tell it kills the cells. Protein synthesis inhibition. Okay. Can we move on? Clostridium. These are interesting microbes. They, except for probably Clostridium Difficile, which found a convenient home in the human intestines, other species are quite accidental for humans. So this is gram-positive bacteria that also forms spores. Okay. Oh, there's a little mistake here. Correct it, please. They are obligate anaerobes. Okay. So they, except for C. difficile, Clostridium botulinum, Clostridium tetani, and Clostridium Perfringens can be found in the soil. all three of them produce toxins. We're going to start, so you can see the picture of the typical Clostridia with the spore. You can see that red dot on the micrograph. This red dot here. Okay, that's the endospore staining of this bacillus. Now, botulism is one of the most toxic, or maybe the most toxic compound that is known to humanity. It works in extremely low amounts, and it pretty much inhibits the signaling, the neural signaling to the muscles, okay, leading to flaccid paralysis. Okay, does that make sense? So, yes.
Do you know the story of how people ended up injecting it in their faces?
Oh, the Botox?
Yeah.
Really small amounts. Just in, how to say, disappearingly small amounts. Botox, yes. Botox is the botulism toxin that's injected into the face, and it essentially paralyzes the muscles in the face, and that flaccid paralysis stretches out the wrinkles. As far as I know, that's what is it for. But if you would look at people who abuse Botox, their faces look like masks because they cannot move quite a few muscles of the face, so they cannot make facial expressions. Does that make sense? That's how it works. It's not a bacteria, no.
I just wonder why anybody would try that. Like how.
Beauty.
I know, but who was the first person to be like, you know what? Like,
I don't really know. I think it was just sort of, well, this works as the way to paralyze. It paralyzes muscles. What if we paralyze facial muscles? And
it's used clinically though to treat migraine, sweat. It's not just cosmetic.
yes, because it generally inhibits the release of ACH. So I think, it blocks. You can do the nerve block with botulism toxin to treat the migraine. Yes, I've heard about it. Since the disease is caused by the toxin, not so much by bacterial replication. For instance, when you probably have heard about that recent case in California, when family got the botulism intoxication and mother actually died because of the botulism. It was from eating a contaminated sandwich or salad. I don't remember what it was exactly, but the point is, food can be contaminated by toxin. Microbe may not be present anymore, the replication competent form. Does that make sense? So in this case, the treatment will be antitoxin. And essentially, those are antibodies that bind to the toxin and prevent its action on the neurons. Does that make sense? Now, to Clostridium tetani, against which we have a vaccine, produces a different, kind of an opposite toxin called titanospasmin, which inhibits the inhibition of muscle contraction, stops inhibition of muscle contraction, causing the continuous, uninterrupted muscle spasm, tetanus, and that's what we mentioned before, the condition that we also name a lockjaw. So treatment, metronidazole is mildly effective. It's a drug that have a broad spectrum effect against anaerobic microbes, not only bacteria. You can treat anaerobic protozoa with metronidazole as well. But mostly, of course, for tetanus itself, we use antitoxin. and drugs that can lead to the myorelaxation, right? But it can be very effectively prevented by the vaccine. Does that make sense? Now, Clostridium Perfringens is the microbe that infects wounds, especially in the limbs. It's commonly found in the soil, and it causes the disease that we know as gas gangrene. It can cause food poisoning. It's much less common cause of food poisoning. But for gas gangrene, what happens? Microbe enters the tissues, and if tissues are anoxic, which means they have low, very, very low oxygen content, microbe will start to replicate because it's an anaerobic microbe. And it will produce the alpha toxin that causes the cell death. So cells will start to die, including nerve cells, which means that gangrenous limb is not going to hurt. It produces the foul smell. And there's no way to restore the tissue, so the treatment for gas gangrene, especially in the lower limbs, we can take lower limbs as an example, is surgical debridement and amputation. There is a treatment with oxygen to prevent further replication. The bariatric, is that called hyperbaric chamber? It's called hyperbaric chamber. Pretty much it's a saturation of tissues with oxygen. So microbe getting killed. Which population of patients is most susceptible to the gangrene? Which? Diabetic. Why?
They're prone to getting foot wounds and skin breakdown because of the diabetes.
But why diabetes impairs the healing of the wounds in the limbs? Yes. So they have poor circulation. It's called peripheral vascular disease. It's practically diabetes leads to the peripheral vascular disease. And because of that association, tissues become anoxic, right? Microbe replicates very well and causes the gangrene. A buddy of mine who worked in the emergency room, he was an ER physician down in Louisiana. In Louisiana, you have people who come to ER. You can just randomly sample them. It's probably 40-50% of them are going to be diabetic. Okay, maybe they didn't come for diabetes, but they're going to be diabetic. So that older African American comes into the ER complaining about foul smell from his foot. So when he takes his boot off, it's a gangrene that consumed his foot all the way up to the ankle. He didn't feel anything. It just said it smelled funny and looked funny. Okay, that's it. So they had to do the amputation right there on site to prevent the further spread. Now, C. diff, Clostridium Difficile. It can be found in the microbiome of otherwise healthy patients. Okay, for example, if you would take a patient with C. diff, then we'll survey this patient and survey the family members of that patient. Almost 100% that you're going to find Clostridium Difficile present in the intestines of the relatives. And if the microbiome, gut microbiome is healthy, presence of all other species prevents C. diff from superinfection, prevents C. diff from over-replication in the gut. However, when people receive the antibiotic treatment, and I'm talking about long-term, high-dose antibiotic treatment, for instance, after the surgery, in case of other severe bacterial infections, that may disrupt, and usually does disrupt, the intestinal microbiome. disrupted intestinal microbiome stops, does not prevent superinfection anymore. So far makes sense? Clostridium difficile starts to grow, causing colitis and dysentery. Dysentery means what is in the stool? Blood. Colitis. The suffix itis, what does that mean? Inflammation. Colitis, inflammation of colon. And think about this, that's kind of chronic inflammation. Colitis can result in perforation of the colon. And that's really bad because then colonic content can enter peritoneal cavity and it's going to be peritonitis and an entire different story. Does that make sense? It's pretty bad. Treatment. Metronidazole as the broad spectrum treatment against, oh Jesus H Christ, anaerobes. And vancomycin, but think about this. If you cause the disease by antibiotic treatment is kind of a lousy way to treat the disease. Does that make sense? And another thing, imagine that you are Clostridium difficile. Is your life in the human intestine easy? No. Why? Oh yeah, it's a cutthroat environment. If they would have throats, you know, it's really tough. You have like 1,500 other species and 10 trillion other cells that you, or 100 trillion, whatever the number, it's huge, that you have to compete with for the food. Okay? So all those hundreds of species that compete for the food, how they can kill competitors? How can they kill them? How one bacterium can kill another bacterium? So they produce chemicals. They essentially produce their own antibiotics. Microbes that are present in the human gut can be intrinsically resistant to antibiotics. Does that make sense? So if you treat with, say, vancomycin and some other microbe, gut microbe, produce something similar to vancomycin just to kill the competition, you've got yourself an intrinsically resistant population. Does that make sense? It was shown that a lot of microbes that we find in humans have intrinsic resistance to antibiotics that we use. So fecal oral transplant is the treatment that is frequently used to treat C. diff. Initially, did we talk about it? So initially what they did, how would you do fecal transplant? Go ahead. Not necessarily so. Not necessarily same household, because, as I mentioned, people in the same household can have C. diff already, so you may reintroduce it. Generally, you take a healthy donor, and if you like people like I like them, you would make them drink. Okay, and that's what they started with. It was a suspension, fecal suspension, that patients drank. What's the problem? You have to pass through the stomach, small intestine, and God knows what you're going to, as a microbe, what you're going to encounter on your way. Does that make sense? What they did next. What do you think? If you can't get it through the front end, you use the rear end, enema. It worked fine. The only problem is it's not the most pleasant procedure. So now they came up with actual pills. Check out Case. I think they have like a a poop donor system. So you can donate poop, and I think they pay for it. Yeah, I don't know if they pay by weight. Don't ask me. I don't know. The point is, they take a healthy donor, fecal matter, and there is a technology to freeze it. So they make capsules with a frozen poop. And then you swallow it, and it has some kind of a envelopment that allows the timely release. So it dissolves in the large intestine, not in the stomach, not in the small intestine. It travels all the way to the large intestine, then releases the microbes. And it's pretty good treatment. There are some problems, though, obviously. Can you think of any? It's a drug, okay? Well, okay, it's a medical procedure. What's the problem? Can you certify it as a drug? Why you cannot?
I mean, in every other instance, we treat it as a contaminant, so now you
Say again?
we treat it as like a contaminant
Okay.
or a carrier of, like, disease.
So you have no idea what's inside, right? It's a big problem, because if you take ibuprofen made in Walgreens or ibuprofen made in CVS, it's going to be same ibuprofen, right? If you take two people and take pool, and they healthy, two healthy people, you take fecal sample, okay, you can run a panel of analysis checking for certain pathogens. How do you know that you check for everything important? You don't. So it's a bit of a problem. Does that make sense? It's kind of still. Yes.
Do only encapsulated probiotics and prebiotics work then if you're, people take them, like if you take probiotic powders, like, does that not work because your stomach acid kills it before it can get to its working?
That's a great question, and I do not have an answer to that. So, if we talk about bacteria that get into your stomach, in your intestine, and make you feel better, then the studies on this are still in the development. So when there are some small-scale studies that show benefits of taking certain microbial species orally. And that's associated with lower frequencies of respiratory infections and better outcomes for C. diff infections and so on and so forth. But those are small-scale studies. I would say that if there is a capsule that contains presumably microbes, and it is said to have a timed release, so like it is released in the intestines, it's always better. Because we know that if we take microbes and put them in the human mouth and the human swallows it, then content of that inoculum, for instance, if somebody would take the fecal suspension and drink it, whatever's in the suspension and whatever reaches the small intestine, it's different. Not everything that makes its way through the stomach.
If they do the fecal transplant instead of just taking like a standardized, not poop, microbial colony or whatever, because it's too complex, you're trying to get lots and lots, hundreds of different species.
You asking the question or you making a statement?
I'm just
You ask.
asking for confirmation. Is that
Yes. There was a study, I mentioned it before, about the microbiome and obesity. And they showed it in mice. It was very clear, very convincing study. They had obese mice and they had normal mice. And they transferred feces, so they excluded the variable of different species. They transferred, they did a fecal transplant from obese to normal. and they induced obesity in otherwise normal mice. They did it backwards, and they made the obese mice lean. Does that make sense? Then they said, okay, we're going to sequence the microbiome and see what species of bacteria are different between the two. And they did a sequence. It's a lot of work and a lot of money. They found like 20 different species, okay, that are very different between the obese and the lean mice. They took those species, they figured out like which ones are more abundant in the lean mice. Does that make sense? Which bacteria are more common in lean mice? They took those 20 bacteria, mixed them together, put them in obese mice. Nothing happened. So there is more than just certain species. There's some sort of interaction, some sort of maybe nutritional interaction. They like community signaling, the quorum sensing that they make, that they do, rather than just mixing them up. Does that make sense? So it's far more complex than we can think of. Okay, we're going to talk about Listeria. Then, if you don't mind, we'll take a break. I'm going to give like everybody 10 minutes break into the restroom. Now, Listeria. That's the wonderful bug. It's a second. I mentioned pneumococcus. Not pneumococcus. Sorry. Streptococcus Agalactiae is one of the common causes for neonatal meningitis. Listeria monocytogenes is another one. Okay? So it's a gram-positive microbe that can be intracellular, okay? As the virulence factor, what I want you to understand, it is hemolytic and psychotrophic. Does anyone remember what psychotrophic means? In which conditions can it grow? Yes, it can slowly grow in the fridge, okay? So it is associated with the food spoilage. In adults, it usually manifests as gastroenteritis, which means, honestly, diarrhea and vomiting, okay? But in children, it can cause meningitis and progress all the way up to encephalitis, infection of the brain. It's really a severe problem, because if a mother accidentally transfers Listeria monocytogenes to the vaginal mucosa, then in mother it's going to be present asymptomatically, okay? But during the delivery, it can be transferred to a newborn. Does that make sense? It is a big problem in the food industry. This map shows you the outbreaks of Listeria monocytogenes in the United States. And you can see that Northeast is pretty dense and Northwest is pretty dense. I have my own theory about it. I thought about it. Don't laugh at me. I think it's because people who buy organic. Because if companies like big agricultural holdings, they're going to sterilize the shit out of everything because they don't want lawsuits. If you go to the little farm and buy milk or poultry from them, you inherently expose yourself to more contaminants. Does that make sense? Just, if they're going to give you just, chicken that was running around in the morning and you buy it in the evening, it probably was not exposed to any cleaning procedures. Okay? So that's because I would understand density of population would explain, but come on, Oregon, Washington, it's not that dense. The only explanation is Portland, really. If you've seen the show Portlandia, you know what I'm talking about. If you didn't, watch it. It's pretty funny. Dry and funny. Now, the disease that it causes, it's the infection. It's not food poisoning, it's the infection. It's intestinal infection and can be treated with antibiotics. Okay. Transmission, of course, soil and water, but the major source of Listeria, it's food contamination. It can come from poultry. It can come from greens. A lot of Listeria outbreaks were linked to pre-washed greens. Because since it comes from soil and water, it can end up on, say, salad leaves, and then they're pre-washed. Of course, it cannot completely remove the microbes, right? And if you think about this, if you have something contaminated with Listeria, and you are in the food prep settings, and you cook, not cook like on the stove, but, prepare the food on the table. And then, yes, you clean the table, but you're not going to bleach it after each batch of salad, right? So wipe it off. It's not going to remove Listeria completely, so there's a lot of chances for cross-contamination. Does that make sense? How can we get rid of bacteria? We talked about phages, remember? When we talked about the transduction and viruses. Phages, what do they infect? Bacteria. Can they kill bacteria? Like generally. Are there phages that can kill bacteria? Oh my, yes, it can. So there is an approved, FDA-approved treatment for Listeria on the food and food prep surfaces. These graphs here show you it was a paper initially, so there's an experimental study on which that approval was based. So what they did, they had food that was artificially inoculated. Does that make sense? So you have a hot dog and you spray it with Listeria. Okay, that's artificial inoculation. And then they treated different food items with that phage spray. Okay? And what they found, I don't know if those letters are discernible. It depends on the item. Hot dogs, chocolate milk, cabbage, lettuce, brine for the mozzarella cheese. In all of those, the phage worked fine. So you see the decrease in Listeria concentration 100,000 times. Okay. Does that make sense? So it's approved, it is used. And can phages infect humans? Humans. Or any mammals. Can phages infect mammals? Come on. It's either yes or no. No, they can't. Bingo. Okay? And that makes perfect sense. Bacteria and mammals are pretty darn different, okay? So they're safe for humans. That's perfect treatment, right? Now, what are the problems with phage? Even in this case. In this case, phage kills Listeria. Talk about any antibacterial treatment. What do we have to think about? There you go. There is none yet, but can be. Does that make sense? But other than that, I mean, it works as far as I know. This looks fine. Okay, let's take a break.